Before we officially start this interview, I have to
Yeah,
get consent to record it. So, do you consent to this being audio recorded?
yeah, for sure.
All right. Thank you. Hello, my name is Oscar Zayas, and this is interview three. Would you please state your name, what you do, and a little bit about yourself?
My name is Jason Gordon. I'm the clinical director here at Larchmont Physical Therapy in Los Angeles, California. I have been here at our office as a therapist for the last 7 years. We mostly treat orthopedic conditions of the human body, and we do physical therapy and rehabilitation for people with injuries, both after surgery and for return to sport for athletes of all ages.
That's great to hear. Thank you, Mr. Gordon.
Mhm.
Um, all right, let's get this started. What problems, in your opinion, exist in baseball that may lead to injuries?
Well, I can tell you from my point of view in my clinic what we see with overhead throwing athletes, which is not just baseball, but volleyball and water polo and all those overhead arm athlete activities is predominantly what we see is the overuse injury. So the shoulder is complex. It's not particularly that stable, and we tend to see lots of rotator cuff injuries, tendonitis, tendinosis, rotator cuff tears, and on the occasion, tears of the labrum, which is the fleshy sock that holds the arm bone into the socket. Um, if we're talking about baseball, once in a while we'll see sort of ulnar collateral ligament injuries at Tommy John's, if you've ever heard of that. Who's the Angel player? Oh, Tony, right?
Yeah.
I think he went out for a Tommy John's, or at least it's a shoulder, an elbow procedure. Yeah, things like that we may occasionally see.
Uh, could you explain the difference between tendonitis and I believe it was like I forgot the other one. It's so similar.
Tendinosis.
Yes, that one.
So tendonitis is basically an inflammation of the tendon. If I'm an overhead throwing athlete and I'm doing this all day long, and my rotator cuff is just getting gnawed away by my shoulder bone, my scapula, it's going to become inflamed, or sometimes it does become inflamed. It's an overuse injury, or sometimes it's a mechanical defect of the shoulder that causes that. Now, that tendonitis, when it becomes chronic, when it becomes something that is longer than, some would argue, 4 weeks, some would argue 6 weeks and beyond months, then it becomes what's called a tendinosis.
Ah,
So it's just it just tells us more about the timeline. And itis is new, and osis is old.
okay. Thank you. That yeah, because I've heard of those terms. I just didn't know the difference. So
Yeah. When you see osis, just think chronic.
uh, okay. So
But to circle back to your question, yeah, typically it's the overuse injury um, that we predominantly see here, and that's a function of someone playing too much on it, not cross training enough, not doing the work to support the repetitive movement that they're doing.
all right. Next question. What are some of the more common injuries you see with baseball players in your clinic?
Yeah, again, we're talking about those itises, right? The tendonitis, the inflammation of the rotator cuff, um, uh, labral tears for overhead throwing athletes is a thing that we see. That's again, there's this fleshy sock that holds your arm bone into the socket, and the tear can happen anywhere around the circular attachment of that area. And when that happens, sometimes they repair it. Sometimes we do what's called conservative treatment, where they come in here and we work on that scapular stability program. Beyond that, baseball players, right? Like you're running, sometimes there's contact, sometimes you're sliding. There's a fair degree of ankles. There's sprinting involved. Sometimes we see some knee stuff happening too.
Yeah. Yeah, yeah. Sorry, I'm still a little nervous.
What? Oh, come on, man. It's me.
All right. Well, yeah.
I mean, dude, I'm an easy interview, man. I'm all good. It's low stress in rehab. We deal with people all day long.
All right. So the next question: what injuries are more abundant, but they could be what injuries can be what injuries that are abundant can be prevented if they pay more attention to it?
Yeah. Again, rotator cuff injuries, pathology, damage, injury, can be totally solved most of the time if you adopt a program of strengthening training for your shoulder. So what we focus on a lot with throwing athletes, someone that's overusing that cuff all the time, is what we call scapular stability. My thumb is in between my shoulder blades. When I pull something towards me, I'm activating everything in between my shoulder blades, my middle trapezius, my rhomboids. These are the big structural muscles that give us the nice base of support to make this become less of a thing over time. So, for example, let's say I'm like varsity pitcher, right? I'm a teenager. I don't do the weightlifting in the gym like coach tells me. I just throw. If I'm weak back there, I'm going to develop that overuse injury out away from the base of support. And we see a high correlation of weakness back here to people that get injury out here in the periphery of their arm. So what we do in rehab and what we suggest athletes get into is that scapular stability program.
To make the back more stronger so you can avoid overuse.
Yeah, your shoulder blade needs to be able to react with all of its attachments so that we're not just leaning on our rotator cuff musculature all day long. So, and again, the rotator cuff are these tiny muscles that hold the ball in the socket. And they're tiny, right? They're like the width of fingers, and they insert all over the shoulder complex. But we can't lean on them to do all the heavy lifting.
I get it. That makes sense. Yeah. That's why you see a lot of rotator cuffs, because they're
see a lot of cuff injuries on people that don't have a strong scap stay program. Scapular stability.
All right, that's very interesting. Actually, I did not know all that contributed to your rotator cuff and your arm.
Yeah. So, like, if part of your training, part of your cross training is in the gym, you should be focusing on that type of stability to prevent injury. So. And that's a big part of it. All the pro athletes are doing it, and they're splitting their days up, upper extremity, lower extremity, leg strength, arm strength, scapular stability. And that's sort of what we try to get our people into that are returned to sport.
That's cool. That is cool. I did not know that. That's insane. I'm learning. I am learning a lot, actually.
Yeah. Yeah, well, again, most people have no idea what we do, so it's always a joy for us to reach out and educate people.
All right. And the next question is, how and why do injuries in the elbow and shoulder affect the player long term?
Okay, so here's where we get into some nerdy stuff. Tendinitis versus tendinosis, right? So we have the itis, new inflammation, and we have the osis, chronic, long-term inflammation. So a chronically inflamed muscle is going to get weaker, and sometimes the integrity of that muscle can get worn down up in the shoulder. So the long-termness of overusing and over-injuring that rotator cuff can turn into a tear.
Yeah.
So if I keep throwing on my injured shoulder, I can develop a rotator cuff tear. And then we get into the world of, do we operate or do we exhaust conservative treatment, which is what we do here in physical therapy. This is like the last stop before you get an operation or not.
All right. Well, yeah, surgery is obviously the last thing you want to happen.
Exactly, right? No one wants to, go under the knife, and then you've got that whole period after the surgery that is life-changing.
Yeah. Okay. Next question. In your professional opinion, when does an injury become so problematic that the only remaining option is surgery?
Again, when that osis, when that overuse injury starts to wear down the and I'm talking about the shoulder here, but this goes for all tissues in the body. It could be a knee, a hip, a back. When we develop an instability, that can no longer be supported, a complete tear, or a chronic arthritis, that's when we start to talk about having a procedure done. And that's when we start talking to orthopedic surgeons about, is this something that will benefit me or not?
All right, surgery is, it's a lot.
We want to avoid it at all costs. So typically, if someone is on their way to surgery, we'll see what we can do here first. And sometimes we see benefit and we can avoid surgery. And sometimes, things might be too far gone. Pain might be too high, right? Yeah. If it's barking at you all day long and you're unable to use it, maybe it's time for a repair or something like that.
All right. Yeah, that's true. In general, what do you think is the best course of action one should take when they're injured?
Well, it depends. I don't want to say it depends all the time, but it depends. So basically, there's this acronym you've probably heard of before. It's called RICE, Rest, Ice, Compression, Elevation.
Yeah, I've heard of it.
Yeah, or price, pressure, rest, ice, compression, elevation. And rest is like the top of the list for an injury, right? We need to remove the stress that's causing the injury if it's repetitive and figure out whether that is the causing factor in things. So I would put that at the top. Usually an acute inflammation does well with ice. But beyond that, the top of the list is activity modification. So that rest is crucial to figuring out what's going on or not. And then beyond that, the gold standard of diagnosis for what happened in that joint is imaging, right? So did you get an x-ray? Did you get an MRI? What do these imaging technologies show us? Is it a complete tear, a partial tear, just inflammation? So then that gives us a better idea on what we're looking at.
Yeah. So, I heard you say an acute inflammation. What does that mean exactly? I've heard of it.
Yeah, so right, the tendonitis is the acute inflammation,
Oh, okay.
and that means that it's new, it's fresh, it's angry, it's upset, and it would benefit the most from something that is anti-inflammatory, like ice, an ice pack on a newly hurt part of your body is typically anti-inflammatory. Now, some things ice isn't really going to help, like a fracture,
Ah, yeah,
right? If I broke my leg, I'm not going to throw an ice pack on.
yeah.
I'm definitely going to go get that X-ray though, because that's diagnostic. That's going to say what it is or not.
Yeah. Yeah. Wow. So just rest, and if you need to, put ice, and definitely go get a diagnosis.
And then you want to seek a diagnosis, right? You want to know what's going on. So the imaging is diagnostic. So you get in with your doctor, your orthopedic specialist, and then we can really see what's happening in there.
All right. Yeah. Next question. What would you recommend athletes should do to prevent or lessen the impact of their injuries?
Ooh, scapular stability lifting program. Right. So yeah, if you work out, if you're an athlete, you should be, and if you're a throwing athlete, you should definitely be focusing on your shoulder stability, right? I mean, you might see YouTubes of throwing athletes in rehab, and there's a lot that we do to address the strength of the shoulder and the range as well. We want to address the restrictions that can happen. Yeah. So my suggestion is to develop a well-rounded program to support your sport. Yeah. Right. So like the lifting, the weightlifting, and the resistance training it's an adjunct. It's all to support that pitch.
Yeah. Wow. Can't believe just because I thought the shoulder was kind of strong before I started this project, but now, now it seems like it needs a lot of help.
It's a remarkable joint, right? It's got all of these degrees of freedom of movement, but it's also can easily be yanked right out of its socket. We see it every day with someone that falls on an outstretched hand. Boom. And then they dislocate the whole thing. And you're like, I don't get it. It's your arm. We use it all day long. But the connection of the ball and the socket, right? The fossa of the shoulder, the socket that ball goes into, isn't really that deep. It's not like the hip, right? The ball and socket of the hip is it's snug up in there. On the shoulder, it's you'd have to think of a golf club that's hanging on the edge of a tree branch.
Oh. Yeah.
Very. Right? Like in your mind, mechanically, think of okay, well, it does its job, but it's precarious in that sense. It's tricky. So.
Wow.
Yeah, shoulders are crazy, man. There's a ton of muscular attachments to it, and they're all kind of doing things that help each other out, and it's also we can have this big range of motion on the shoulder, and it's awesome, right? Hand behind head, hand behind back, but yeah, we got to protect it.
Yeah, wow. Shoulders.
Mm-hmm. I know. We're on a shoulder tangent. There's so much more, though. That's just one joint.
Yeah.
But, it seemed like your questions were baseball-centric, so I'm just
yeah.
It's such a big part of what we see here.
Yeah. It's a big injury risk in baseball as well. So
Absolutely. Absolutely. You see it every day in the reports.
yeah. All right. Uh, this one, yeah. This is the next question. What practices to prevent injuries are often overlooked?
Um, Proper training. Again, you got to have that lifting program going on to really prevent injury. We focus a lot on that scapular stability for the pitching athletes. We also focus a lot on, like, you have to be able to sprint, right?
Yeah.
Running is this sort of like one direction forward activity, but it's controlled by all of these forces that act on you from the side. So what is your cutting ability, right? Think of like a push off, like in basketball, or off of a plate. How strong are you on the sides of your legs for being able to do that?
Ah.
And then we get into things like hip stability. How strong are your glutes at being able to push sideways to get away to start that sprint? And so we work on, all kinds of things like that too to help.
That's yeah. Wow. How much proper training can do for you?
Yeah, and we do it all day long here. People come in for any number of sports that they're involved in, and this could be youth athletes, college athletes, semi-pro, weekend warriors, all the way to senior citizens, and you name it, all across the board. Your participation doesn't stop as you get older. So we work with everyone on that stuff.
Yeah. All right. Could you give a month by month timeline on an athlete's rehabilitation towards playing the sport they love after surgery?
Okay. Gotcha. Every surgery is different. Every post-operative protocol is different, right? So what happens after the surgery is often dependent upon what surgery you had. For example, if I had my rotator cuff repaired, overhead athlete, I develop a complete tear of my supraspinatus, which is a rotator cuff muscle.
Okay.
Doc says, I want to go in there with a camera and with my instruments and reattach it and anchor it back onto your arm bone. He would do that, and I would come out, and for 6 weeks, I would do nothing. I would be in a shoulder sling, just hanging out, right? We're in the protective phase of healing. We don't move it. We don't use it. We don't push things. We don't pick things up. Then at that 6 week mark, so we're kind of moving towards month 2, we start to come out of the sling. We start to develop our ability to hold the arm on its own against gravity. And then we start going to physical therapy where we work on passive range of motion. We're going to move it for you when you start to come in here. And that's in your second month. And by the end of your second month, we're going to start to move into what's called active assistive range of motion. You're going to use your left arm to help your right shoulder get its own range back. And we have a number of activities and exercises to get you to do that, both here in the office and then on your own. When you go home, you got to do your homework. It's like work. It's your new workout. So that's going to be in your second month. And by the end of your second month and in your third month, we're going to begin resistance training. So by about week 10, we'll start to do things like, can you do a row with light resistance? 3 pounds of force, like not really that much at all. Can you develop your own range of motion against gravity, moving your own shoulder? Is it full? Can you get it full again? And then from month 4 to 5, we're building up that resistance training, right? How heavy can you go? How heavy can you go? How strong can we get that rotator cuff against resistance? And then by about the 5th month, we're going to start to return to sport. Can you do your overhead throwing exercises. How's about we start with a ball like this and you're just catching it and dropping it? What is your pitching distance? Maybe we're starting at 25 feet. Light overhead throwing. We're going to push you out. Can we get to 40, 50 feet? Can we increase the speed on your throw? Is it pain-free? Does it feel good? Does it look strong? Things like that. So it's really like, yeah.
Wow.
That fifth month is where we would be kind of getting back into what looked like what you were doing.
Wow, it's a long procedure.
It's long, right? It feels like a long time, but that's we need to preserve the integrity of that surgery. Like that doctor went in there and took a muscle the size of your finger and retied a knot like that, and then did a little anchor down onto the top of your arm. I mean, it's insane what they do, and we got to protect it, right? Because it's doing a lot.
Yeah. All right. Wow, that's crazy. That is very wow. This is unfortunately the final question.
Yeah.
Bless you.
Yeah.
Who else would you recommend that I should talk to explore this topic furthermore?
I think the best thing to do would be to find an actual patient, someone that's actually gone through this, a relative or a friend, someone that would be willing to talk about it, because you're not going to get a better story than someone that actually went through it. We deal with that all day long here. I hear the story of patients all day long, and that's sort of what makes this job awesome, is we get to connect like that. But you won't hear it any better what that experience is like than from someone that's actually gone through it. Beyond that, you could interview an orthopedic surgeon,
all right,
a doctor that does these surgeries, and they'll give you their opinion and their timeline on what they do and how that looks, especially in the injury side of things. But usually we're seeing them after the fact, and we're working on the training part here.
Yeah. Well, this interview was very fun to do. I very much enjoyed it. I will let you go now because it's almost 9:30 and I have to probably get back to work.
Yeah, I got another patient, 9:30. So, reach out to me if you need any more information. Always happy to help. Sometimes kids, high school and college that are interested in seeing what it's all about here, that want to get observation hours and stuff like that for their various schools that they're going for. Sometimes we'll have them in the clinic to see what we do. So I want you to feel free if you or anyone else is interested, and just reach out to my email, and let's get it.
All right. Thank you. Have a great rest of your day, and hopefully you have a nice weekend.
Yeah, Oscar, you too. Have a great weekend. Good luck on your project.
Thank you, Mr. Gordon. Have a nice day.
All right. Have a good one.
You too. Bye.